My name is Abofele Khoele, and I am the Managing Director of Organon in Sub-Saharan Africa. Now, Organon is a newly formed women's health company. Started around the same time that you set up your website in June last year. So we've been in business for about 8 months. It's a global company that is headquartered in New York and is listed on the New York Stock Exchange, but it's focused on women's health. Our vision is for a better and healthier every day for every woman. And it's really important to note that, of course, in the past, women's health has really not been a priority. And it's for the first time that a big player in the pharma sector has come forward and stood up and said, we want to lead the charge at changing this for women. We're looking at access in equity, and equity in terms of gender as well. So that's who Organon is. We're coming with a whole portfolio of products focused on women's health. So looking at fertility, contraception, but also at other stages of a woman's life. So at menopause, at diseases that only affect women, like endometriosis, fibroids, but also those that disproportionately affect women, such as autoimmune diseases.
Now, when you look at Africa, of course, 8 months is a short time, but as an organization, we have lots of history. Do you think when we have better focus, we can be better delivery in this kind of space? Because healthcare is just starting to warm up in Africa, I guess. So the kind of focus that you have, what is the delivery?
Yeah. So as I mentioned, I think for us an important deliverable would be to broaden access to healthcare, particularly among women. We've seen that in the last decade, certain indicators of health have improved in terms of women's health. So maternal mortality has come down slightly. We've had the transmission of HIV in women and girls come down slightly, but it's not enough. And of course, with the COVID pandemic, it has set us back a little bit as well. So the key focus is to ensure that we have increased access for women in terms of healthcare, and seeing some of those indicators actually improve over the coming period.
Now, of course, being based in South Africa, you are here at this conference. What brings you to Nairobi this time around?
Well, Nairobi is a beautiful city. Any excuse to be here. But certainly the AHB conference, I think, is a seminal conference in our year. I think this is the 7th installment of the conference, the first face-to-face in 2 years, so we couldn't miss it. But certainly the focus this year on how the private sector can collaborate with the public sector in terms of improving the level of healthcare for women on the continent, I think for us was a big attraction to make sure that we get here this year.
If you look at the structure of the continent, probably look at lots of, because healthcare has been largely in the hands of government, the private sector has come in. Do you think that there are still some things in around regulation and policy that actually work against delivery for better healthcare for women?
Yeah, so I think there are a number of things, right? The first one is that, as Africans, we know we are a very patriarchal society, and the focus hasn't really been on women's health. And now, as we move deeper into the 21st century, it has to become a priority. The second thing is, in the past, we really depended on government to provide the healthcare services. And we're realizing more and more that without all sectors being involved, it's too big of a problem for government to solve by itself. So it's important that we are sitting on the table when policies are made, and we include the relevant people. We can't be talking about women's health here without having women around the table. So we need to make sure that all the important stakeholders are able to put in their 2 cents worth in formulating policies, and also then in energizing the implementation of those policies and plans.
Yeah, I think the involvement part is really key, and it's something maybe that we hear a lot in this conference as we go on. Now, as a business, as you look forward into the next 1 year, 2, 3 years, what are some of your key priorities, particularly in the rest of the continent, as a young organization in this continent?
So we've got a number of priorities, right? The first one, of course, is to broaden our access program for contraception. Even though we're a new company, we've got a long-standing contraception program that provides access to modern contraception around the African continent. And we provide about 5.5 million women every year with that contraceptive choice. And over the last 8 years, we've done about 25 to 30 million patients. And we intend to broaden that. So from 5.5 million patients, we intend to grow to about 8.5 million in the next 2 years. And that's the first thing. The second thing is we want to increase access by entering new markets. Currently, we are in about 32 markets around the continent. We want to broaden that. We're fortunate that in East Africa, we've got good coverage in Kenya, Tanzania, Uganda. But we want to broaden into West Africa, enter Nigeria, enter Uganda. In Southern African region, we are not present in Angola. Let's see what we can do in Angola and Mozambique. And we accept that by being present in those markets, we are providing access to women in those markets. And the third thing we want to do is then broaden our portfolio. As I mentioned earlier on, we do have therapeutic areas in women's health. We do have some established brands, but we're really interested to make sure that we also focus on those diseases that have previously been neglected. Things like PCOS or endometriosis, diseases that women really struggle with on a day-to-day basis, but that have really not had a focus. So those are our three priorities as we move forward over the next 2 or 3 years.